Hi, Mike Gibson, Daniel Jones coming to you from ESC 2023, and we're talking about the nitrate contrast induced nephropathy trial. As an interventional cardiologist, Daniel, I am always worried about contrast induced nephropathy. We haven't had a lot of things work in this area. Tell me why you think inorganic nitrates might reduce contrast induced nephropathy.
Well, thank you, Martin. Thanks for taking the chance to talk today. I mean, inorganic nitrates, which I think it's important from the start to say are different from organic nitrates, which most interventional cardiologists are used to. So things like isosorbide mononitrate, which are medicinally synthesized, contain carbon, they're different from inorganic nitrates, which are found endogenously and within the diet. And that's what we tested in this trial. And they are very potent sources of nitric oxide, which is then metabolized or reduced within the body to nitric oxide. And that has lots of beneficial effects, which will prevent contrast-induced nephropathy. We know from basic science studies that an important step in the development of contrast nephropathy is a reduction in NO. And actually, if we could replace this lost NO with an effective, safe source of nitric oxide, such as dietary and organic nitrates, then potentially we could prevent contrast nephropathy. And that was the hypothesis behind the trial.
So, Daniel, where did you get these inorganic nitrates? Are they something you can get off the shelf? Are they available currently medicinally?
So you can find it, I mean, it's essentially a dietary, so you can find it naturally within leafy green vegetables. Normally, the doses that we would use the doses we would use in studies to try and prevent things like contrast nephropathy, you find in beetroot juice, which has been shown to reduce blood pressure. However, because we wanted a high dose to be administered for a short time period, we used a pill, so a potassium nitrate pill, which contained 12 millimoles of dietary nitrate, which would be equivalent to 2 concentrated beetroot shots, which you could normally purchase on the shelf. But we didn't feel that a patient could take 2 shots prior to a coronary angiogram and an intervention, so we went with the pill instead. So it was a manufactured pill, but of a dietary supplement.
And was this trial blinded? Did people know who got the pill and who didn't? Or it was randomized? Was it blinded?
Yeah, it was double blind. So you were randomized to potassium nitrate or potassium chloride. So we matched the potassium concentration to ensure that that wasn't an effect on the development of contrast nephropathy. But neither the patient nor the investigator was aware of what treatment the patient had, and they were indistinguishable from a pill perspective.
And how did you define contrast-induced nephropathy?
So we use the KDIGO criteria, which is recommended in the UK by NICE, which is split into 3 stages: stage 1, stage 2, stage 3. Stage 1, which is typically the commonest, was defined as an increase in your creatinine by 26 micromole within 48 hours, or a 1.5 times by 7 days.
And 26 micromole, what would that be in milligrams per deciliter for a US audience?
Uh, Good question. I'd have to check. I'm
Good to
not sure.
check. Okay. So using KDIGO criteria, and talk to us a little bit about the methodology. I mean, how many patients? These were ACS patients. What were their baseline characteristics? What kind of creatinine and GFR did they have on entry?
So it was 640 patients, 321 in the placebo group, 319 in the dietary nitrate group. The average age was about 70, 55% were diabetic. The vast majority, 85%, were troponin positive. And this was non-ST elevation myocardial infarction, 15% were troponin negative. We had 70% male, so 30% female, and about 25% were non-Caucasian, which is quite high for a contrast-induced nephropathy study. In terms of EGFRs, 60% of patients had baseline chronic kidney disease, so an EGFR of less than 60.
And what did you find?
So we found that there was a overall rate of 16% contrast nephropathy, but when we split that into the 2 groups, there was a 30% event rate in the control group, but this was significantly reduced to 9.1% in the patients that took the dietary inorganic nitrate for the 5-day period, which was a significant reduction in contrast nephropathy.
Wow. And were there any subgroups that stood out that benefited more than others?
So we had a predefined subgroup analysis based upon troponin positivity, diabetic status, and gender, and there weren't any specific subgroups, as it was beneficial independently of those. We did find that in patients that were already taking an organic nitrate, so isosorbide, that there didn't seem to be as much benefit, but the
Hmm.
numbers in that group were really quite small. Only about 70 patients were established already because they're an acute coronary syndrome group. So I think it's difficult to read too much into that. And there was still a benefit, just not as much as in the patients who weren't established on organic nitrate.
And the 16% event rate, was that what you predicted? I mean, did the study have an event rate that you predicted? And what was your power, your statistical power?
So we had 90% power for a 60% reduction in conscious nephropathy, assuming an event rate of 12% in the control group. So 16% overall was a bit higher. We were a bit surprised by the event rate in the placebo arm. 30% was higher than we predicted, but I think we were initially probably expecting a slightly lower risk patient population, and our Merin score, our risk of conscious nephropathy was higher than I think we'd estimated originally. And we were looking at an average Merin score of 10 to 11, which would be around 25 to 30% contrast nephropathy. So I think we picked a higher risk group than we'd expected.
So where do we go from here, Daniel? I mean, that's a big reduction, I got to be honest, and highly statistically significant, highly clinically significant. I was asking about the event rates to get at, is this, believable in terms of, type 1, type 2 error? What are your thoughts? Do we need additional studies? Is this a pilot that needs validation, or does this change practice?
Yeah, I mean, that's the key question. I think it was a single center study, so there'll always be questions raised about generalizability in terms of patient populations. I think in addition to seeing the reduction in conscious nephropathy, we did see improved renal function at 3 months.
Hmm.
And we saw a suggestion of a reduced event rate at 12 months in terms of major adverse cardiac and renal events. So that, I think, suggests that there is a real signal there. We didn't just see a chance finding in the reduction of conscious nephropathy. We did see harder endpoints later on in the patient's journey also trend towards improvement in the nitrate group. I think clearly we weren't powered for those other endpoints. We were just powered for conscious nephropathy. And I think this suggests that dietary and organic nitrate may well be a perfect solution to prevent conscious nephropathy. But I think this study is the first of probably further studies to really get this into clinical practice. I think we really need a multi-center study following on from this to prove the reduction in conscious nephropathy, and hopefully again show benefits in hard clinical outcomes at 12 months.
Well, congratulations, Daniel. Amazing work. Well done. Well powered, and amazing, result. Obviously, hypothesis generating, as you're saying. I look forward to seeing what you and others do to kind of validate this. If it's true, it really does move the needle. Something that's been very refractory to us getting it right.
Thank you. Thank you for the time.
Thanks, Daniel, for joining us, and thanks to all of you for joining us here from ESC 2023.